Hi, I'm Charles Reynolds. In your office every day, 4 out of 10 women, if they're like the rest of the U.S. population, have sexual problems. Sexual dysfunction to the point that it's distressing the woman. 4 out of 10. Yet, latest research, or the latest thinking from a practice bulletin in obstetrics and gynecology in April of 2011 is that only 14% of women ever have a conversation with their physician about sex, probably because we avoid the conversation because we have little to offer the patient. And if you look at the possible solutions for these women, 4 out of 10, that's 50 million women in the U.S. alone. 4 out of 10. And by a JAMA article in 1999, it seems to be a higher incidence in premenopausal women. So this is not an insignificant problem. And in that JAMA article, it also said sexual dysfunction is a serious psychological and social problem that deserves serious attention, and the psychological problems seem to be worse in women. We think about it as men because I think we have lots of ads for little pills and beautiful women who come in and tell us to write prescriptions for these little pills. But there is no little pill like that for women. Perhaps, in this same article, Practice Bulletin, Obstetrics and Gynecology, April 2011, perhaps testosterone may work. That was it in the way of prescriptions. Hysterectomy, if she's got a fibroid or something, of course, but in the way of medical treatments, there just isn't that much available. Well, maybe antidepressants, but remember, to be counted as a statistic, the woman has to be bothered by the dysfunction. So if she's got inability to have an orgasm and she doesn't complain, she's not counted in that 40%. So I have to wonder, if you give her an antidepressant, does she just slip out of that because she doesn't care anymore? Anyway, that may be a pessimistic view, but the truth is that there is very good research showing that relative to men, there's not that much out there in the way of research and solutions for sexual dysfunction in women as far as medical treatments go. So, what's new? What's new is that if you look, PRP has been around a long time. Platelet-rich plasma has been used by the orthopedic surgeons, it's been used by the oral surgeons, it's been used by the veterinarians, and there is a mountain of research. A mountain. And now we even have biopsy studies from December of 2011, a biopsy study, documenting that you get true new growth of fibroblasts, adipocytes, even neovascularization, as you should when you activate unipotent stem cells using platelet-rich plasma. So what's new is that we are offering this as a way to help women's sexual dysfunction, and surprisingly, it's working very well. We're injecting directly into the clitoris, we're injecting into the roof of the vagina, and we have found that it makes a big difference where in the roof you put it. Are you going to hurt the woman if you put it in the wrong place? No. I mean, you're putting into her body what she would normally make in recovering from a surgery. You won't find a serious problem in the medical literature from PRP. If you do, please let me know. I haven't found it in all of these different indications. But we found there was a huge difference in the way the woman responded. So for that purpose, for that reason, we are offering to teach you exactly where that is and keep this name O-Shot or orgasm shot clean by making sure everyone who does it, this will go across different specialties, obstetrics, gynecology, urology, family practice, internal medicine, anyone who's adequate at doing a competent pelvic exam on a female should be able to do this procedure. It's not a complicated procedure. Once you see it, it's like a magic trick. Until you see it, even drawing diagrams doesn't quite explain how it should be done. But once you see a movie of it being done exactly where the needle goes, you'll get it and you'll say, oh yeah, and you'll be able to go do one, teach one sort of thing. All right, so why trademark? Why do that? Why try to control it? Okay, well, because I like the example of Juvederm. Here you have a product or a substance that can be put into the body. And you have some people, and it's easily obtainable, you can buy Juvederm pretty much if you have a medical license, but some people do it and create women who look like they came from another planet, and others take a woman and restore her face to a very fresh and beautiful shape. but there's no way to figure out which one you're going to see if you walk into a physician's office. So the purpose of a mark, a trademark or a service mark in this case, the mark does not apply to a thing, it applies to a way of doing something. And by keeping that way clean so that anybody who uses that name has documented that they understand that way, then patients have the assurance that they will have a good outcome, and that is worth a lot to a patient. What patient wants an unpredictable or generic results from an injection that's going into her genitals? Now, so the patient wins by having assurance that the person knows what they're doing. How does the physician win? The physician wins by having more patients come into their office and having assurance about a procedure on my genitals makes that procedure worth more to me. It's like buying insurance, that this will be a good outcome. So the person's willing and eager to pay you more money because you have gone to the trouble to demonstrate that you understand the nuances of how to use platelet-rich plasma and platelet-derived growth factors within the genital tract of a woman. So I don't pretend to be smarter than anyone. I just am offering a way to basically have a club of shared knowledge, and it becomes a respected group of providers who know how to do the procedure, and it becomes a buyer's club, because what happens if the manufacturer of Juvederm wants to go up on the price and you've been advertising Juvederm, you either have to re-educate your patients about a new product or be willing to pay the higher price. Also, that price can be you're providing what fee you're able to obtain for that Juvederm can be driven down as more people provide it. So you're able to charge less, and for your materials you're having to pay more, meaning that you make less money for the procedure. So everything has to be ethical. If I'm giving something that's more valuable, then everyone's happy about giving me more money for that more valuable thing or service. That's what the mark does for you. At the same time, if a better or more economical way, either research shows a better, more effective way to make the platelet-derived growth factors, or as effective but less expensive way of making those growth factors becomes available, then I can change the way of making the growth factors and still keep talking about the same name, the orgasm shot or the O shot. So it becomes almost like a buyer's club. And that's exactly what happened with the vampire facelift, another trademark procedure. It's what's happening when you go into a Chick-fil-A or any fast food restaurant. You don't know where the meat comes from, and I'm sure they bargain to get the best price for the best product to keep their standards up and their costs down. So what about the FDA part of this? If you want to make a kit that makes platelet-rich plasma, then you would have to go through the FDA to prove that your kit makes good platelet-derived growth factors and that it's effective in whatever area you plan to use it. So the kits that we are using are FDA approved for producing and isolating growth factors from the whole blood of patients for use in the orthopedic suite. So we're using an FDA approved kit, but we're using it off-label. So those same kits are used in dental surgery. It's the same growth factors. The platelets in the face and the platelets in the knee are the same platelets in the genitals. So those same growth factors, of course, as you would know, that stimulate unipotent stem cells to heal the face or rejuvenate the skin of the face or heal the oral tissue during surgery or heal the knee, all of which have been documented by research. Those same platelets would, and seem to appear, we haven't done biopsy studies, but appear by the woman's response to rejuvenate the vaginal tissue. So that's what we're doing. And what I'd like to do is invite you to enter the membership area, look at the videos. We have a half a day's worth of lectures from a hands-on workshop we did in La Jolla with my co-inventor, Dr. Samuel Wood, MD, PhD, infertility specialist out of La Jolla, California. Look at these lectures that he and I and his partner Benito Villanueva did there and see how we're doing it. And there's a little test just to document that you saw the procedure done, and it's not anything complicated, but you do have to see it. So there's a test documenting the amount of volumes and the way we're doing this. And once you've seen the materials, documented that you've watched the procedure, then we put you on oshot.info so that people can find you. This is not a complicated hysterectomy or fibroid tumors, or this is not endometriosis where you have to dissect the bowel away from the ovaries. This is an injection, so you can see how to do it, but you do need to see how to do it. And we do want those who are on the website, oshot.info, to agree that they are willing to do it in this way. Now, if you decide that you don't want to participate, then you can just take what you learned and go do whatever you want to do with it. You just would not be able to use the name OSHOT or Orgasm Shot in advertising your services. I can't control what anyone does in their office, wouldn't want to try to control what anyone does in their office. But we do have ownership of that name, and we can maintain the integrity of that name, which works to everyone's benefit by making sure everyone who uses that name has documented and agreed to support the name. So that's how it works. If you don't use the name, then the license agreement wouldn't apply to you. You go out and do PRP injections in the nose, in the vagina, in the ear. It's none of my business as long as you're not using the OSHOT or the Orgasm Shot name. So anyway, that's kind of how the trademark works. It's being done in other parts of medicine. Synergenics is a service brand name way of using hormones. You have Medifast, different ways of using basically protein powder to help people lose weight. Those are marks demonstrating or protected names that indicate a particular way of doing something. So this has been done in all parts of business, including medicine, and it seems to work to everyone's advantage. Patient, doctor, and even the suppliers of the materials, because if they offer the best product at the best price, they get our business. So that's the deal. Look at it. I hope that you'll join us. I really think it's going to be a game changer. There are very few things that you can do that are safer for your patients than giving them an aspirin. 30,000 people a year die from nonsteroidals and aspirin GI bleeds. No one's ever died from PRP or had a serious sequelae. So this is a procedure you can do, possibly change a person's life in 10 minutes or less, make an income from it that's worthy. You deserve what you're being paid because you are possibly changing the woman's life. And at the same time, you don't have to lose sleep at night. You don't have to worry like a complicated surgery if they're going to bleed or if there's going to be adhesions or something else is going to go wrong. So you get to sleep at night and have smiling patients. So thank you. I hope that wasn't too long, but I tried to answer every question that people have asked me. And if you have any other questions that you want to ask me, feel free to call my personal cell phone that's listed there or text me, and I will be eager to embrace whatever questions you have and hopefully embrace you as a provider of this, I think, game-changing, revolutionary way of treating sexual dysfunction in women.